Trying to read tiny words on your phone, you notice they're blurry. You stretch your arm out, hoping the text sharpens to make sense of it. If this sounds familiar, you're not alone. Many people face this challenge with close-up tasks as they age. This common vision change is known as presbyopia, and it is a natural part of the aging process for your eyes. While it is impossible to stop time, you can effectively manage how presbyopia impacts your daily life. This discussion will explain what presbyopia is and, more importantly, reveal a widespread daily eye care mistake that can significantly worsen its symptoms. You will learn how to avoid this common error and adopt healthy habits to maintain comfortable and clear vision. Presbyopia is simply the natural, gradual loss of your eye's ability to focus on nearby objects. You can think of it as your eye's natural zoom lens, losing its flexibility over time. It is not a disease, but rather a normal change that almost everyone experiences as they age. Contain a special part called the crystalline lens, located just behind the iris, which is the colored part of your eye. This lens is typically very flexible, changing its shape to help you focus on things both far away and up close. Tiny muscles, known as ciliary muscles, are responsible for controlling the shape of this lens. As we get older, two main changes occur. The crystalline lens slowly loses its flexibility, becoming stiffer and making it harder for it to change shape and focus on close-up items, and simultaneously, the ciliary muscles that help move and shape the lens also become less effective. These changes mean your eye struggles to correctly focus light onto the retina, which is the back of your eye, when you look at something nearby. If you are developing presbyopia, you might notice several common signs. The first symptom is difficulty reading small print in books, newspapers, menus, or on phone screens. You may also find yourself holding reading material farther away, extending your arms to get enough distance for the words to become clear. Strain and headaches are also common, making your eyes feel tired or achy, especially after doing near work like reading or sewing. Things that used to be clear at arm's length might now look fuzzy, and you may find yourself needing brighter light, turning on more lamps or moving closer to a light source to see things up close. Presbyopia typically begins to manifest in your early to mid-40s and gradually worsens until you reach about 60 to 65 years old, at which point the changes in your eye's lens often stabilize. Presbyopia is a natural part of aging. Medical research confirms it cannot be truly cured or prevented in the same way a disease might be. It is a universal change for our eyes, much like getting gray hair or wrinkles, but its symptoms can be managed very effectively. Now that we understand what presbyopia is, let's address a significant mistake many people make that can exacerbate their vision problems. The primary eye care mistake to avoid every day is prolonged, uninterrupted near focusing without adequate breaks or appropriate vision correction. In simpler terms, it involves forcing your eyes to struggle and strain when they can no longer focus well on close objects, instead of providing them with the necessary assistance. You might mistakenly believe that if you try harder to see, your eyes will get stronger. Medical experts and extensive research show that struggling to see up close when you have presbyopia actually causes more harm than good. When your eye's lens has lost its flexibility, forcing it to try and focus beyond its natural ability is akin to trying to lift a heavy weight with tired muscles. This leads to increased discomfort, a burning sensation in the eyes, and general exhaustion as your eyes work overtime without success, draining their energy. Furthermore, constantly pushing your eyes to focus when they cannot will make blurred vision. Headaches and general eye fatigue feel much worse and occur more frequently. This creates a frustrating cycle where every close-up task becomes an uncomfortable experience. Unlike some muscles in your body, the crystalline lens and ciliary muscles do not get stronger by being forced to strain. Their changes are structural, meaning the lens itself is becoming stiffer. Struggling against this natural process will not reverse it. It only adds stress to your visual system. Based on clinical understanding, eye strain can worsen symptoms but does not improve the underlying physical changes of presbyopia. This mistake also often delays getting proper help, as many people postpone obtaining reading glasses or other corrective lenses because they feel they shouldn't need them yet, or are trying to fight the changes. This delay means living with unnecessary discomfort and frustration. The more you strain, the more uncomfortable and less productive your near work becomes, potentially causing you to avoid activities you enjoy, such as reading or hobbies that require close vision. This mistake often occurs in various everyday situations. Instead of reaching for reading glasses, you might find yourself squinting, tilting your head, or holding your phone at arm's length for extended periods. Spending hours on digital devices without breaks also contributes, as many of us look at phones, tablets, and computer screens for long durations, causing constant eye strain if not properly corrected. Working in poor lighting further exacerbates the issue, forcing your eyes to work even harder to gather enough light and focus. Additionally, some people hesitate to wear reading glasses due to aesthetic concerns or a belief that they will make their eyes lazy, leading them to continue straining unnecessarily. Avoiding this mistake is the crucial first step toward managing presbyopia comfortably. The good news is that managing presbyopia and preventing eye strain is quite straightforward, primarily involving the adoption of appropriate tools and healthy habits. Embracing appropriate vision correction is the most effective way to manage presbyopia. This means giving your eyes the right tools to do their job comfortably, not that your eyes are failing. Over-the-counter reading glasses are readily available at pharmacies and stores without a prescription and are excellent for individuals with similar vision in both eyes who only need help with reading. They come in various strengths, such as FL100, FL150, and FL2.0, allowing you to try different strengths to find what works best. For those with different vision in each eye, or other vision problems like astigmatism, a doctor can prescribe custom reading glasses for more precise correction. If you already wear glasses for distance vision, you might need bifocals or progressive lenses. Bifocals feature two distinct viewing areas, one for distance vision at the top and a segment for near vision at the bottom, separated by a visible line. Lenses, also known as no-line bifocals, offer a smooth transition between distance, intermediate seki for computer screens, and near vision without any visible lines, making them a popular choice because they resemble regular glasses. For those who prefer not to wear glasses, multifocal contact lenses are an option, with different power zones for near, intermediate, and distance vision, enabling clear sight at various ranges. These are available in both soft and rigid gas permeable types. For some individuals, surgical options might be available, though these are more advanced procedures and not suitable for everyone. Corneal inlays involve placing a tiny lens in the cornea of one eye to improve near vision, while refractive lens exchange (RLE) replaces the eye's natural lens with an artificial multifocal or accommodating lens. These surgical options are discussed with an eye doctor to determine suitability. Beyond corrective lenses, implementing the 20-20-20 rule is a powerful, simple tool to prevent eye strain, especially if you spend a lot of time on digital devices or doing close-up work. This rule advises that every 20 minutes, you should take a break from your near task and look at something 20 feet away for at least 20 seconds. This allows your eye muscles a chance to relax and reset. According to eye care professionals, consistently applying this rule significantly reduces fatigue and discomfort associated with prolonged near vision. Optimizing your visual environment can also considerably reduce eye strain. Always use bright, glare-free lighting when reading or doing close-up tasks. A good task lamp shining light directly onto your work can make a big difference. And it is best to avoid working in dim rooms with only a bright screen, as this creates harsh contrast. Digital devices position your computer screen about 20-24 inches, 50-60 cm from your eyes, with the top of the screen at or slightly below eye level. If glare is an issue, consider an anti-glare screen protector for your devices. Furthermore, do not hesitate to enlarge the text on your smartphone, tablet, e-reader, or computer, as most devices have settings to increase font size, making reading much more comfortable. Regular comprehensive eye exams are extremely important, particularly as you age. Annual check-ups allow an eye doctor to monitor your vision changes, update your prescription for presbyopia, and check for other eye conditions. These regular exams can also help detect serious eye diseases like glaucoma, cataracts, or macular degeneration early on, when they are often easier to treat. While presbyopia is a natural part of aging, supporting your overall eye health can help manage its symptoms and keep your eyes healthy for years to come. What you eat plays a vital role in the health of your eyes, with medical research consistently highlighting the importance of certain nutrients for eye function. Antioxidant-rich foods, particularly those containing vitamin C and E, help protect your eye cells from damage. Vitamin C is found in citrus fruits like oranges and grapefruits, berries such as strawberries and blueberries, bell peppers and broccoli, while vitamin E is present in nuts like almonds and peanuts, seeds such as sunflower seeds, and leafy greens. Lutein and zeaxanthin are powerful antioxidants that accumulate in the macula, the central part of your retina, and help filter harmful blue light. These can be found in kale, spinach, collard greens, corn, eggs, orange bell peppers, and other brightly colored fruits and vegetables. Omega-3 fatty acids are healthy fats essential for retinal health and can help reduce dry eye symptoms, found in fatty fish like salmon, mackerel, as well as flax seeds, chia seeds, and walnuts. Zinc, an essential mineral, helps transport vitamin A from your liver to your retina to produce melanin. A protective pigment in the eyes is found in oysters, red meat, poultry, beans, nuts, and whole grains. Carotene, which the body converts to vitamin A, is important for good vision, especially in low light, and is abundant in carrots, sweet potatoes, and other orange fruits and vegetables. While a healthy diet is the best way to obtain these nutrients, some people consider supplements. It is crucial to always talk to your doctor before starting any new supplement, especially if you have other health conditions or take medications. For example, lutein and zeaxanthin supplements, often recommended at a typical daily dose of 10 mg of lutein and 200 mg of zeaxanthin, like internal sunglasses, protecting the macula from harmful blue light and oxidative damage, with studies suggesting their crucial role in maintaining macular as we age. They are generally considered safe, but consulting your doctor is advisable if you are on specific medications. Omega-3 fatty acids, commonly recommended at 1,000 to 2,000 mg of total EPA/DHA daily, are vital components of retinal cell membranes, known for their anti-inflammatory properties and ability to improve dry eye symptoms, which can worsen discomfort from presbyopia. Fish oil is the most common form, with algal oil as a vegetarian alternative, but high doses can interact with blood-thinning medications. Vitamins C and E are powerful antioxidants that protect eye tissues from damage caused by free radicals, important for overall eye health and maintaining the health of blood vessels in the eyes. Doses of 500-1000 mg daily for vitamin C and 400 IU for vitamin E in eye health formulas. High doses of vitamin C can cause stomach upset, and vitamin E can interact with blood thinners, so medical consultation is important. Crucial for normal retinal function, and vitamin A transport to the retina plays a role in maintaining macular health, with common doses ranging from 25-80 mg daily, often combined with copper because high doses of zinc can interfere with copper absorption. High doses of zinc can cause gastrointestinal upset and may lead to a copper deficiency over time. Beyond diet, your daily habits significantly impact your eye health. Drinking enough water is beneficial for your entire body, including your eyes, as proper hydration helps maintain moisture and reduces dry eye symptoms. Wear sunglasses that block 100% of UVA and UVB rays when outdoors, even on cloudy days. Long-term exposure to UV radiation can increase the risk of cataracts and other eye conditions. Quitting smoking is extremely important, as smoking significantly increases your risk for many serious eye diseases, including cataracts, macular degeneration, and optic nerve damage. Managing systemic health conditions like diabetes and high blood pressure is also critical, as uncontrolled high blood sugar can damage tiny blood vessels in your retina, and high blood pressure can also harm eye blood vessels. Work with your doctor to manage these conditions effectively. Regular physical activity improves overall blood circulation, ensuring your eyes receive adequate oxygen and nutrients. Finally, getting enough sleep allows your eyes to recover from the day's strain and stay healthy. Many people also explore additional ways to support their eyes, but it's important to have realistic expectations about what these approaches can and cannot do for presbyopia. Exercises are often suggested for eye health, such as palming, near-far focusing, figure eights, and pencil push-ups. These exercises can certainly help reduce eye strain, improve the flexibility of your eye muscles, and enhance overall visual comfort, making your eyes feel less tired and more relaxed. However, it is crucial to understand that these exercises do not reverse or cure presbyopia, which is caused by a physical hardening of the eye's lens that exercises cannot change. While they can make your eyes feel better and more comfortable, they cannot restore the lost flexibility of your lens. So manage your expectations carefully. Eye exercises are a tool for comfort and strain reduction, not a cure. Some individuals explore traditional Chinese medicine practices like acupuncture or acupressure for general eye comfort or to address related symptoms like dry eyes or headaches. While some people report feeling relief from general eye discomfort, there is limited to no strong scientific evidence from clinical studies to show that acupuncture or acupressure can reverse or stop the progression of presbyopia itself. Similarly, certain herbal remedies, like bilberry extract, have been traditionally used for eye health. However, while bilberry has been studied for its potential antioxidant properties and its traditional use for night vision, there is no robust scientific evidence to suggest it has a direct impact on reversing or preventing presbyopia. As with any supplement, it is always best to discuss herbal remedies with your doctor. While presbyopia is a normal change, some vision symptoms warrant immediate attention from an eye doctor. If you experience any abrupt blurring, a sudden loss of vision, or new visual disturbances like flashes of light, floaters, curtain coming down over your vision, you should see an eye doctor immediately, as these could be signs of serious conditions. Severe pain, severe redness, or any unusual discharge from your eyes could indicate an infection. inflammation, or another serious eye condition requiring prompt medical care. If your current reading glasses or contact lenses no longer seem to help, or if your vision feels significantly worse even with your correction, it is time for an updated prescription. Even without alarming symptoms, it is essential to have a comprehensive eye exam every year. This allows your eye doctor to monitor the progression of presbyopia. Update your prescription as needed and check for any other potential eye diseases that might develop with age, as early detection is key for many conditions. In conclusion, presbyopia is a natural part of getting older, affecting nearly everyone as their eyes gradually lose their ability to focus up close. The biggest mistake you can make is trying to push your eyes to focus when they cannot, which only leads to unnecessary strain, discomfort, and headaches. By understanding presbyopia and actively avoiding the daily mistake of straining uncorrected eyes, you can take control of your vision. Embrace appropriate vision correction like reading glasses or multifocal lenses. Consistently practice the 20-20-20 rule. Optimize your visual environment and maintain a healthy lifestyle. While you cannot stop the natural process of presbyopia, you can significantly manage its impact on your daily life. With proactive care and healthy habits, you can continue to enjoy clear, comfortable vision for all your close-up tasks, living comfortably and clearly by giving your eyes the care they deserve.